Hello, my name is Sherri Alderman. I am a developmental pediatrician at Children's Developmental Health Institute in Portland, Oregon. I am here today to talk with you a little bit about autism. I have a special interest in autism. I do diagnosis and intervention for families who have a child with autism. I also have a strong belief that the earlier that we can identify autism, the more effective our interventions can be to support that young child and family to develop ways to work around the autism to build their social emotional development. Autism is, as the CDC tells us, on the rise. They tell us that 1 in 88 children now will have an autism spectrum disorder, and that among boys, that number is 1 in 54. So there are many children who are being diagnosed with autism, and we are learning ways to effectively address that for families. It is a spectrum, and so we know that children present in many different ways. All of the children, however, have a fundamental impairment in social engagement and social interaction, and that is the way we approach it when we are helping that child to learn how to have more effective social interaction with others. The CDC has learned the Signs Act early information on the web about how we can be more aware when we have concerns. If a parent has a concern, we know that there is something going on, maybe autism, maybe something else, but we always want to act on that. For instance, a baby who is not making those big, wonderful smiles in interaction with those around them that love them so much and do not have the warm, joyful expressions reflecting back to that parent, that is a red flag for concerns, autism or possibly something else. By 9 months, that baby should be making to and fro sharing of sounds. So those wonderful interactions, making sounds back and forth, is a very important sign that a child is or is not developing socially the way we would expect. And then by 12 months, that is a very dynamic time. By 12 months, a child should be responding to their name very consistently, shifting their gaze toward the direction of the person who is calling their name. They should also be babbling and having lots of baby talk during this time. And they should be using gestures. They should be starting to point and starting to show and reaching and waving, all of those fun things that our communication should be very robust and active at this time. We should be concerned if at 16 months of age a child has no spoken words. And by 24 months, we should be very concerned if there are no meaningful two-word phrases. And this does not include a child who just repeats what they have just heard or is imitating what they have just heard, but they in fact are making those on their own. So what do you do if you have concerns? First of all, you should know that when a parent has a concern, there is something going on. And you should not be fearful immediately that it is autism, however, because it can be a variety of things. You should, however, contact your pediatrician and let them know what your concerns are and communicate to them what you are seeing or what you are feeling that concerns you about your child's development. You should be persistent and reinforming them if you do not get action that satisfies what you find of concern. And you should also call your early intervention program. The early intervention programs provide services free of charge to families for children who are having any kind of developmental delay. And they can help you also advocate for your child. So we know that, in summary, autism is on the rise. We also know at the same time that there are wonderful ways of interacting and intervening in order to support that child. Brain research also tells us that the earlier that we intervene, the more effective our services will be. We can, during that time of neuroplasticity, as that brain is developing, we have a wonderful opportunity to make a difference. Typically, developing children naturally come upon those social skills to be able to interact in the social circles that they live in. Children with an autism spectrum disorder can learn that in other ways. So I encourage you to advocate for your child, to be persistent when you have a concern, and to follow through on recommendations to actively address any issues of concern for your child's development. Thank you very much for listening today. I wish you the very best and wonderful life with your child.